Well, good evening. I'm Rick Dancer. Welcome to it's actually this is not Get Real with Rick Dancer right now. It's Littlejohn. I'm changing my name. I found my brother from another mother, and I'm changing my name. What we're going to do tonight is talk about something that's really super important. In fact, for the next several weeks, we're going to be going over some different things that a lot of us don't understand. For the first night, we're going to talk a little bit about Medicare. Because you have to sign up. The enrollment period is coming up. But this isn't just for old farts like me. We're going to have young conversation too. We're going to be talking about Obamacare in the coming weeks, what people under 65 need to do. So it's just kind of this time of year is when a lot of enrollment's going on for insurance companies. And, let's just face it, a lot of us really don't quite know what to do. And so a lot of us don't do anything. And that's the wrong answer. So that's why Scott Littlejohn joins us.
Hey, guys.
And so you are, what agency do you work for?
I work for Littlejohn Insurance. So imagine that.
Your own company.
Own little name on it. Yes, I work for Littlejohn Insurance. Many of you might know me out there as a farmer's insurance agency, which I still am. But the other side of my agency is that I have a health insurance brokerage. So I've been delving and working in the health insurance world for probably the last 8 years or so. And it's really become really probably my favorite part of my business, to be honest. I mean, I love my farmers people, but this has been a lot of fun to learn to do.
So right off the bat, we got to get over with Littlejohn is not a Native American name, because people are going to be going, wow, that's quite the name there.
That's correct. It's more of the Robin Hood and Littlejohn type scenario. So my dad gave me the family crest years ago and has always hung his hat on that. It was nice because I was taller than everybody when we were kids, but then they all cut up, and then it was just either LJ or Littlejohn or array of whichever way you want to put it.
Well, with a last name like Dancer, we knew that there was some Cherokee blood in there too. We always thought this was, that was a Native American name. And it's actually like yours, it's English. They were entertainers. So go figure. I didn't fall far from the genealogy pool, I guess, huh?
Someone's got to do it, right?
So Scott, talk to us first. Tell us about the enrollment period for Medicare is coming. We're in it right now. What does that mean?
That means this is the time of year when you have your chance to enroll into your 2021 Medicare Advantage plan for the next year. It happens every year. It happens between October 15th and December 7th. So you get a chance to change your Medicare Advantage plan going into 2021, or you can change your Part D prescription drug plan if you're on a supplement plan or a Medigap type plan during this period.
So when can people get on Medicare?
When you turn 65 is pretty much the magic number. There's a 7-month window called your initial election period, where it's 3 months before your birthday month, the birthday month itself, and then 3 months after your 65th birthday. So that's the one way you can get in like that. Or if you've been on disability for 24 months, you are in the 25th month, you actually become eligible for Medicare at that point as well.
Are people pretty confused about this? Because we're all going to get there, we hope. And probably a lot of young people are going, I'm not going to, what's that all about? But this really is.
No, it never happens. You're going to be young forever. Don't worry. This is not going to apply to you. But, God's good. And if you make it there, it does happen. And it is kind of confusing. There's a lot of parts to it. You hear a lot of letters. There's, your Part A or your Part B, Part D, or you hear about these plans with F and G, a whole alphabet that goes to it. It does get a little confusing, and it ties in with, your Social Security. It ties in with your eligibility for working for at least 40 quarters or 10 years in a lifetime. And if you're married or you have a spouse and those things that go along with it, those can tie in too. So there's a lot of factors that come together.
And if you don't get signed up, you're not in.
Essentially, yeah, you can find yourself kind of out in the cold if you don't take those steps when it is your enrollment window. It's not to say that you can't get in again, but you may end up finding yourself waiting for a whole year if you don't take advantage of your initial election period around your birthday, or if you don't. There's some penalties that come if you don't get your prescription drug plan in place in time that are actually long-lasting for the rest of your life type penalties, as far as additional premium you might pay on that drug plan.
So one of our viewers says, pay attention, it sneaks up on you. It goes forbid you get it injured and are on SSDI. So
yeah, I mean, definitely, you pray that that's something that doesn't happen to anybody with the SSDI thing. But, those who are on disability after 24 months, you do become eligible for the Medicare program, and it can make your health insurance, your health plan a little bit easier to work with, at least at that point.
So what does a Medicare plan look like?
Well, Medicare itself you have a few things, there's some things that go into it. So there's what's called original Medicare, and it's made up of two parts. There's considered Part A, which is your hospital portion, and then there's your Part B, which is your doctors and testing services and such that go along with that. Between Parts A and Part B make up what's called Medicare. You can, at 65, you can elect to go on to just original Medicare. So during that 7-month window, you need to sign up for your Part A through the Social Security Department. And you actually go to the Social Security website. You can always call me and I can help you do it too. But when you get to that point to your eligibility window, you sign up for Part A. And the way that you are eligible for Part A is that you've worked 10 years and paid into your payroll Medicare taxes for 10 years. That's what makes you eligible for the program. So all that you paid into it for such a long time makes it so the program can work, and that the government, the federal government, can fund your Part A premium, and you sign up for it at that point when you become eligible. The other part is the Part B portion. So you can choose to either sign up for Part B at 65, or you can pay it yourself. And if you're not going to take Social Security at 65, you can wait. You can still enroll in Part B, but you can pay for it yourself at that point. And that is, it splits up to where the Part A is actually 20%, Part A is 80% of Medicare, and the Part B makes up the other 20% of what is considered the whole Medicare, portion.
So that's why there's people like you, because my mind is going, whoa, this is a lot of, it's not easy. And you can sit down with people and really kind of coach them through, because my situation is going to be very different from Karen Wright's. She says on here, I have medical plan F. Do I need to change for 2021?
The plan F is what's called a Medigap, or a supplement plan. So what Karen's doing is she's enrolled in her Part A. So the government's paying that 80%. And she's also enrolled in the Part B to make up the full 100%. And what she's done is chosen a letter supplement Medigap plan, and what that does is you pay a premium for that plan F. And so let's say, your Part B premium is $144.50. That's going to come out regardless of whether you're on what's called a Medigap supplement plan or a Medicare Advantage plan.
Okay.
So that's going to be paid regardless. And you have to pay that Part B in order to be eligible for a Medigap or a Medicare Advantage plan, regardless. Those have to be paid. But the Medigap plan F has I'm reading some of the comments here and they threw me off. The Medigap plan F has its own premium that goes with it. And there's 3 types that they have. It's either age attained, or it's called community rated, and it depends on the insurance company how they price that. But the idea is that you pay for a plan F, and F was always the Cadillac plan. If you turn 65 after the 1st of January 2020, you are ineligible for a plan F. You're grandfathered in if you have it before, so you can move from one company's plan F to another during your birthday month. Every year there's a 30-day window to do that. So it starts the day of your birthday and goes for 30 days. But the idea behind a supplement is you pay a plan premium that goes along with that, that's beyond your Part B premium. So let's say it's $180 a month to have that plan. Once you pay the deductible that's associated with that plan F, anything else that original Medicare would cover under Parts A for hospital or Parts B for the doctor's offices would be covered by the plan F supplement. So the F would pay the bills for anything that would be covered under Part A or Part B once you pay the deductible on it. And as long as you pay the premium for that Part F, you can go into the hospital, and when you come back out, that Part F is going to pay the bill for you, and it'll go for the entire distance of that policy.
Karen said, thank you.
Yeah, I hope it's kind of confusing. And I'm waving my hands around a lot. I usually use a couple of visuals to show people how it works a bit better. But it's not the worst thing. This is a good question here.
Okay, go ahead.
So since this SSI told me that I don't have to do anything, I have an employer sending it. Okay, so if you're working and you're part of a group plan, that group plan, if it provides what's called credible coverage between your Part A and your Part B, and then there's the other part that I haven't hit yet, which is your Part D. That's your prescription drugs. So it breaks down with your Part D is what actually pays for all your prescriptions. So like on that Plan F that Karen mentioned, she's also paying for a separate Part D premium beyond that Plan F. And that's where the prescriptions come from. So if your group plan covers covers the A, B, and the Part D at a credible level, which is Medicare tells you if it's credible or not. If it's not good enough coverage, they'll send you a letter and say that this isn't good enough coverage. But if they say you have a credible plan and your employer is willing to pay for that plan still, by all means, stay on that plan, whether you're 65 or not. You should still enroll in your Part A through Social Security because there's no cost. So do it during your 65. When you hit 65 during that window, you want to enroll in Part A because it doesn't, that's still your enrollment window for that, whether you're covered on a group plan or not. But you don't have to take Part B. You can still stay on your employer's plan. And then when you retire or you step down from that plan, you get a 7-month window at that point at retirement that becomes your Part B enrollment window. And that's when you can pick up Part B. And so during that time, you don't have the, you don't necessarily have, you won't have any penalties because you waited till you were 70 to sign up for Part B because you had credible coverage that covered you from 65 to when you retired.
So Lynn wants to know, what kind of deductible are we talking about?
So it depends on the supplement. So this is on the Medigap side. So those Medicare supplements, the deductibles vary by the plan that you choose. So there's like F, which has always been kind of like the Cadillac plan, as we called it. You can't get an F anymore. Like pretty much the best one I would say you could get is called a G. It's just one step down. And really the difference between an F and a G is that the G plan pays your Part B deductible, which is $185. Okay. So the F used to pick up the F, if you still have it, will still pick up your Part B deductible. But if you have a Part G, you end up paying that $185 as well. Once you go to your first doctor's visits, you'll pay that first $185 out of there on your supplement plan, and then it will pick up everything else beyond that. So the deductibles on a G or an F vary by plan, and you'd have to look at them specifically. A lot of times, the Part F can be about $149 for its portion.
So Lynn has the Part A. I had A at the time.
Yeah. So if you have an A, it's if he's got an A supplement, that's likely going to be a higher deductible because when you look at the supplements on a board, there's kind of a graph. You'll have FG, A or C. There's certain supplements on there, and it'll tell you the Medicare categories that go with those, what is covered by that supplement or not. So the lower your supplemental letter, typically the less you'll pay in premium because it doesn't cover as many of the original Medicare categories with that supplement.
Okay.
So maybe it'll only cover 80% of that hospital expense, or it'll only ever cover 50% of that expense, but you're paying a lower premium for it. And hopefully you're not going to use that supplement as much. So it matters when you sign up in the beginning. That's a big one.
I've known you for like probably 3 or 4 years. And this is not a hit, Scott, at all, but you're smart. I didn't know you, man. You know you're smart. No, I'm sitting here going, wow, I know where I'm going when I hit 65 or 64 because I'm going to get ahead of the game, so I know what I'm doing before this happens.
Well, I appreciate that.
That's awesome.
It's my wife tells me sometimes, she's like, man, you're really good at this. You just don't give yourself any credit. And maybe I don't, because I'm a really horrible marketer, which is why I'm on your show, because I'm so bad at like talking about it for myself. But with all my clients, every time I sit down, I use the same thing. And whether it's hey, Giri.
Yeah, say hi to people. If you know people, say hi.
Yeah, hey, man. Whether it sounds like a line, but it really is the truth. I consider myself an educator and not a salesperson. Because if I can stop the buck on your questions here at my desk or virtually wherever we're having our meeting at right now, if I can answer all your questions and put you in a position for success to make the best decision for yourself, it's usually going to be a decision that works out well for both of us. And so if I can just, I represent most all the carriers. So it's a matter of figuring out what works best for you. And then we can put you where the best plan that's going to work exactly for that. I ask the questions, but it's nice to know the answers and not have to go and figure the whole thing out yourself. Go to an expert. And it doesn't cost you any money to do it. And I don't charge for my service to do this.
So you're a broker then?
Exactly. I'm a broker. So like I said, I have Farmers Insurance, which I'll do your home and auto, and I'm happy to do that through them. And that's great. I've been doing that for 13 years. But I got into health insurance when Cover Oregon started. If you guys remember that was quite the little experience. And I kind of had to learn through the school of hard knocks. I had to figure it out. But by learning it that way, the hard way, and not really, no one really mentored me in this. I had to dig into it and really figure it out and read through policies and read through the changes that happen and all the different company specifics that go with that. But what it's done is it's really put me in a position to be a great educator for people, because I want you to be in your best position. It's not about me. This is about you when you come here and work with me.
So are you surprised at how much you know?
It's maybe sometimes, yeah. I mean, yeah, I guess. It's funny because my wife, Emily, whom I love dearly, hi out there if you're watching, she is helping me this year. We actually met at work. She was the, company Inc., whatever you want to call it. She was the trainer at Farmers. So she was like the go-to and still is one of the most impressive insurance people I know.
So she's smarter than you.
She's definitely smarter than me. So, but she was the one, I started doing this and she's come on with me this year. So the two of us are doing this. So
that's
she
awesome.
with the company. Yeah. So, I mean, I moved into a new office. I'm right over across from the Campbell Community Center. I used to be downtown on 7th and Charlton, but I'm right across from the Campbell Community Center here in the park by Ferry Street Bridge.
We're practically neighbors.
I know. Look at you over there, right?
Yeah. I'm on the other side of the tracks.
Oh yeah, the good side.
Well, I don't know.
So she teamed up with me this year, and we got her appointed with some of the carriers. But I sat down to kind of do the lesson with her, and she was just like, "Wow, you really know your stuff." And she could just tell a difference when I talk, because trust me, I know my stuff on cars and homes and that stuff too, and business. But she's like, there's just a different light that comes on when I talk about this, because I really like the transparency of being a broker and showing, it doesn't matter who you pick. I've got most all of them, and I'm going to be able to put you in the best position. So it's not about making a real sale. It's just about educating somebody on what's going to work best for them. And I see people walk out of my office just with the weight lifted off of them, is what it feels like. They come in confused, and they go out with it simplified, knowing that we've set something up for them and that they've got the information they need to actually succeed at this and take their Medicare journey or their healthcare.gov journey, and know that they're set. They're in a good place.
Because I think a lot of us get, especially if we're going to switch over to the Medicaid system, you're on this other system for so long. I mean, it's nerve-wracking because you don't really know what you're getting into. And insurance is scary anyway, because you feel like the deductibles keep getting higher. And I mean, it's just like, I mean, mine, I broke my wrist once, and the good news was there's my $7,000 deductible gone. So now I can have anything done. Yeah. I do Botox. No, I'm kidding.
You don't have it.
I'm having my butt lifted. I mean, I can do anything I want.
The silver fox of Lane County, and you know it. Come on now.
Hey, any major changes for 2021? Donna had asked that.
Yes, and Tammy, yes, definitely come talk to me. The big major changes are there's been some changes to a couple of the Medicare Advantage policies out there. Bigger changes on the healthcare.gov side. I'm going to be Rick and I are going to be doing more of these throughout the next 5-6 weeks. So we're actually going to be hosting more of these shows as soon as thanks, April. As soon as some of this stuff, as soon as open enrollment starts on November 1st, that's a different story with regular under 65 health insurance. But as far as the plans, I can't necessarily, they're very regulated. So there's some rules that go with this Medicare stuff. If you're going to talk about a Medicare supplement, I can talk about those, no problem. The plans change. There's been some different, they're all coming out here next month for healthcare.gov. But on the Medicare side, there's been some supplement changes. There's been some rate increases on certain carriers. On the Medicare Advantage side, I don't really get to talk about those specifically because you have to, every agent or broker you sit down with is going to have you sign what's called a scope of appointment, or they'll send it to you ahead of time. And really, basically, you have to sign off. It's their cover their butt sheet, essentially. You sign off that it was okay to talk to you about these products before you even start. And you have to get that permission because it's part of the application process is to get the scope of appointment. And during that time, you actually mark off what you want to talk with them about. And if you're going to do any Medicare Advantage plan, that's part of the deal. And if you have someone who's not doing that with you, they're not sticking to the rules. And it's not that I want to be a stickler for rules, but I want to keep my license so I can keep doing this with everybody else.
Well, and make sure people are safe.
Exactly.
So do I have my employer fill out a form? I'm confused when they said that I don't have to do anything, but if there is a gap in employment, then I have to pay a penalty. I thought the insurance mandate was unconstitutional.
No, the mandate's a totally different thing. The mandate has to do with healthcare.gov, and that's when they were putting a tax on you if you didn't carry the insurance. And during when they passed tax reform in 2016 or 17, part of that reform was that they took away the individual mandate on the Obamacare Affordable Care Act. So it meant that they can't charge you the tax that they used to charge.
Right, I remember that.
Yeah, people were getting a charge for 2.5% of their adjusted gross income, or modified adjusted gross is what the actual term is. But you'd get a tax of 2.5% on that if you didn't carry health insurance, or they'd tax you proportionately throughout the year for the time that you didn't. And so you'd all of a sudden, let's say you're lucky enough to make $100,000, all of a sudden you have a tax bill for $2,500 come through that you weren't expecting. It's like, whoa, what happened? So tax reform did away with that law, with that rule. So it essentially took the teeth out of the Affordable Care Act to where if you don't have it, there's no penalty there. But if you're on the Medicare side and you're turning 65, you should still go apply for your Part A when you hit your 7-month window, the 3 months both sides of your birthday month, because what it'll become is secondary coverage to your group employer coverage. And whether it's reported to them or not, that depends on the employer, what they want to see. But I would go ahead and do it because there's no penalty for you for signing up because you are eligible for Part A at that time, whether you're working or not. And there's no charge because that's the government's portion that they pay. And let's say, the other part is original Medicare is basically an 80-20 split. If you don't want to pay your Part B and you just want to go down the original Medicare road, you can do that. Original Medicare is 80-20, but there's no cap on out-of-pocket max spending. You go in and you're going to see an 80-20 split at the hospital, and finding someone who actually takes original Medicare outside of a hospital is kind of tough because it's a lot of paperwork and a lot of doctors' offices just don't want to deal with that. Right. And that's why you're going to end up likely wanting to have that Part B and getting yourself a Medicare Advantage plan, which is a private insurance plan, or you're going to get a supplement plan that goes along with your Part A and Part B, because that's also a private insurance carrier that they're working with.
So are you saying the tax is gone?
Yeah, the tax is gone. You don't have that penalty, for this year. It won't affect you. If you didn't have insurance, you can expect, there's no line on there that says you can still, if you're carrying insurance and you've done it through Obamacare, they're going to send you what's called a 1095B form. I think it's 1095B, and you'll get it through your healthcare.gov account, or it'll be mailed to you in early February, much like you get a W-2 from your business. You'll get this from the federal government, and it shows you exactly how much you paid for over the 12-month period that you had your policy, and it'll show you exactly how much advanced premium tax credit, or APTC, which is exactly what it sounds like. It's a tax credit in advance for the year based off what you think you're supposed to make for that year. And the auditing mechanism is you're filing your taxes the following April. So the whole idea behind Obamacare is you pick the amount, you pick what you think you're going to make for the year. They don't care about your assets or anything like that. What you think you're going to make for your modified adjusted gross income. You put that in the application, and the way that they audit that is you file your taxes the following April, and you see how close you got. And they're going to give you a premium credit in advance to pay for your insurance premiums throughout the year based off that guess.
But you better not make more than that.
Well, that's the thing. If you make more than you said you were going to make, they're going to take back some of the money they gave you because you technically weren't eligible for it because you made more than you said. So you got more than you should have gotten, and they'll take it back as a tax. But vice versa, if you made less than you said you were going to make, you'll actually get a tax credit to give you the money that you should have been eligible for in the first place. So it's kind of this teeter-totter effect. Yeah, no, come and talk to me, Tammy. Providence, there's a lot of great options on there. But I do all of them, and that's one that I work with. But I'm talking about Obamacare on this. I'll just call it Obamacare, even though it's Affordable Care Act or marketplace.
Yeah, I think most people know what that is.
I just use that as a general term because people know what it is. But the way that whole program works, I mean, that's where I started. I started with that, and I know that stuff inside out, forwards, backwards. It's kind of sad.
So for younger people out here in the audience under Medicare age, you can help them with that too, understanding what the changes are as they come through and get them set up to, because most people,
absolutely. It all starts November 1st. You can start getting an appointment with me now to do it. I will take you through it because, I mean, right now there's a way. I mean, I'll show you how to get a $100 deductible out of that program. You know, if you want, I'll show you how it works, but it's on you how you do your thing. You know, I'm going to show you the ropes. You can tie yourself up with them and do whatever you want, but I will explain the whole thing. And Robin, to speak to your question is, if you don't want to do anything, just until you're 70, you won't have to until you're 70. But what'll happen is, if you just take original Medicare at 65, or I'm not sure if you're working or not, if you don't take your Part B, you can take it later on, but there'll be a late enrollment penalty for it if you don't have credible coverage that makes up for it when you want to take it. The penalty that you're really thinking about is the Part D penalty. What happens if you don't sign up for prescription drug plan that is credible within that first enrollment window time? Every month that you go beyond that, if you pick up a 1% penalty that applies for the life of that prescription plan. Yeah. So like, let's say you go 12 months afterwards, but it only starts to apply when you actually get a prescription drug plan again. So let's say you step in at 67 and you want that plan, they're going to charge you 1% per month, you know, starting that 4th month after your birthday, or I should say 5th month, really. So 1% each month, and that will be a percentage multiplier against the premium of the second lowest priced Medicare prescription drug plan, standalone plan available in your market. So let's say there's a $20 plan out there and there's a $17 plan. That second most expensive one will be the one that they use.
Okay.
They would charge you that percentage multiplied against the $20. So you would see it, okay, I have a 25% penalty. I'm going to have to pay $25 for that prescription drug plan. And that stays on for the life of your prescription drug life.
So Barbara's asking, when you're about to turn 65, you automatically enrolled?
You're not automatically enrolled.
That's what people think, huh?
If you're on Social Security already, if you are already doing your Social Security benefit before 65, you will be automatically enrolled. They will put you onto Part A and Part B if you're taking, if you're already collecting your Social Security before you hit that age. You will be automatically enrolled into Part A and Part B. If you want to disenroll from Part B, you can do that. But you don't start paying with it necessarily until you get to 65, because you're not using the Medicare system at that point.
So this is Dakota. He's a younger guy. He's probably your age. Yeah. He's going,
come see me, man. We'll get you dialed in. I promise.
This is confusing. Dakota, in your case, you're a few years from needing this service, but he could also help you with your other insurance needs for in terms of Obamacare or anything like that you might be on. Robin says, which is not $144 a month now. Why are there so many different parts?
Because the government needs to make a lot of money. Apparently, I don't know. I didn't write all the rules. I just tried to learn them. The parts to it are different. They may not all apply. Really, the basic rule of it is when you hit 65 or whenever you become eligible, you have 2 roads to go down. You can either go down that Medigap supplement road, or you can go down the Medicare Advantage road. And at this time, it does not matter what your health is, your physical health at all. They have to take you on either plan.
Okay.
So let's say you're coming in and you're using a lot of services. It probably might be a good idea for you to go down the Medigap supplement side, because if you're going to be in and out of the hospital or using a lot of these services, it's nice to know what the managed care amount might be.
And you have more choices that way too, right?
Well, it's not necessarily more choice. It's more of a managing your cost that goes along with it, because you're going to have to get a standalone Part D for your prescriptions. But if you have a supplement, and once that supplemental deductible is met, it means that whatever you do when you go back and forth, that's going to be paid by the supplement once that deductible is met. And so you can manage your cost of care by knowing, I'm going to just continue to pay the premium on this supplement. And as long as I do that and I've paid its deductible, I'm good to go for the full year. And then I'll just start it again in my birthday month the following year.
So Tammy says her husband didn't sign up for D years ago, $33 a month for life, because they didn't tell him. And Tammy, if you want, just so it makes it easier, Scott's phone number is right there going on the bottom of the screen. Why don't you write that down?
Yeah, you can call or text me.
Call and text him, and that way you'll make sure that you get to him and he'll know what you're doing. So Scott, can I ask you, this is kind of a totally non-related question to insurance, but why do you do this? Why do you?
I kind of fell into it in a weird way. I always wanted flexibility of time. I wanted to be a pro athlete growing up, but I wasn't really good enough to do that. So here I am. And I wanted to be a newscaster too. I thought it'd be fun to be near sports. So I actually was a news reporter for 3 years when I got out of college. I went to U of O and I did terrible, and I got myself a communications degree. And then I went to work in Roseburg for $7 an hour. And the next thing I know, I'm making $9 an hour in year 3, and I'm just broke. So insurance was always and it took all the fun out of sports. Going to Mac Court and watching Oregon Husky and the Washington go down to the wire and not being able to clap and press row really takes the fun out of being there. And so I decided that this was always going to kind of be the fallback. For me, was insurance, which I found out is not really that easy to do. It's not
really hard.
Yeah, it's harder than I thought. But my whole plan was always really simple, and excuse my language on some of this, but it was always just stick around. Don't be an asshole.
Right.
And that was it. That was the plan. Not a really solid business plan, but I know Eugene. I mean, it's Kevin Bacon Town. We're so degrees of separation. We all know each other. So I've just tried to kind of keep my nose clean, because I want to have business in town and get a chance, and I'm not really good at raising my hand and asking. So I'm here piggybacking on Rick because he's got the platform. So
well, and I like what you're doing, because I think this is super helpful for people. Even like Dakota's on here saying, does the cost for your services change based on your income? If so, is a 401 included in that calculation?
A 401k is not. It's not. Is when it comes down to Obamacare stuff, they don't care how much money you have in the bank or anything like that. It's all about what you're going to make for the year and what comes out on your modified adjusted gross income line at the end of the year. So that program is based on that. When it comes to Medicare and Medicaid, that's a different story. They will check your bank account there, because to be Medicaid eligible is also a financial spot to be in. And that's one where you can be subsidized on your Part A or your Part B premiums, and you can be subsidized on your pharmacy costs too, through what's called Social Security Extra Help. There's bridge programs out there. There's lots of different ways to help. And I help people apply for that too, and understand how it works, because it can take what could be a premium that would cost you quite a bit and actually knock it down to minimal or zero premium in a lot of cases. So that's based on your family household size. Household size is all about how, go Billies. Household size is all about who's on your tax return. So the more people who are on that tax return, the more money you can make. And it's all based on the federal poverty chart. And Oregon has its own numbers. And I can show you that chart in one of our other another meeting. Yeah, and it's hard to get all the information out of this. It really is specific to the individual. So,
but here's the good thing about doing this, because now Robin knows here's a person I can go to, and then Scott can sit down with you, Robin, and your family, and just figure out exactly what you need to do. But I think this is really interesting to have these questions, because I don't think insurance is not something that people talk a lot about.
Oh yeah, I mean, I just sit down just talking all the time. No, insurance is boring. I mean, who wants to do this? Let's be honest. You don't need to learn it yourself.
But if you don't, but I'll tell you what.
But I will try to make it enjoyable, and honestly, I love my clients. And the best advice I got was, I love my clients. they love me back. I tell them I love them, and they love me back.
Right.
And that's kind of how I try to do things. Because genuine and authentic, and you guys, I live in the same town. I want you guys to live great lives, and health is something that's obviously important to all. We're going through this pandemic. I mean, it's just been nutty. But if it's something that I can help you break down, if I can help get it explained to you in a way that's really going to fit for you and your family, there's ways that I can try and save you some money or show you how that can be done, how all the networks work, primary care, PPO versus HMO, all the acronyms that they throw at you like you're just supposed to know. People, you forget that it's complicated. There's a lot to it.
So Scott, has COVID and the election and all this different stuff come, the fires and all that, has it made you kind of reassess not what you do, but how you do your life?
Oh, definitely. I figure it kind of breaks up into thirds. About a third of people have really done well during this time. About 2/3 of people have had a real struggle during this time.
Right.
Because I have all walks of life walk through my door. I work with everybody. I don't discriminate. And those who are on Oregon Health Plan or anything like that, I help people sign up for that all the time. And there's no commission in it for me when it comes to Oregon Health Plan or anything like that. It's just the right thing to do.
Right.
And I also do home and auto. So that happens sometimes. But really, at the end of the day, what this has done for me is it's really shown me how important my family is.
Yeah,
my time with my family. I've got 4 kids. I've got a soon-to-be 8-year-old. Hi, Lucy. And I've got Jenna, who's 5, and I have Charlie and Calvin, who are my 3-year-old twins. And it's just to be at home was a blessing. I'm back in the office now because it's kind of crazy at my house. It's hard to get stuff done. But we have really just realized how important family is. It's really brought me a lot closer to Jesus for me. And I just realizing that there's some foundational things out there that whatever side you're on, I know there's a debate tonight and all that stuff. It's the things that matter to all of us are really pretty universal.
Right.
And that's, love for each other and love for your family. And I just want to enjoy my day. I just want to have a good time, try and have a good time doing what I'm doing. And that's why I came to you, Rick, because I think you live an exemplary life of putting yourself out there and just doing it in a way that is exciting to do it because you want to live every day.
Right.
That's what I'm trying to do here. And even in an empty office right now, it's been really fun to just connect with you and see some of these questions that people actually are curious about, because there's a lot of questions out there and I'm happy to answer them, to be honest.
So Dakota, I want you to write down his number and get a hold of Scott. Dakota's a new friend of mine.
Yeah.
And he can help get you kind of situated and know what you're doing there, Dakota. Because honestly, I would not even know what to even think or question. I think we got through everything on here on our list.
Yeah.
And you guys, we're going to be back next Thursday, same time. And we're going to have a new topic, but we're going to be doing this for several weeks to kind of get you all in a place. So if you have questions or know people who are in this process, or your work is right now saying, hey, we're ready to go sign up on our new plans and that kind of thing, it might be worth running it by Scott to see. Grateful.
Group plans, any of that stuff. Sadly, I've learned enough about it to where you shouldn't have to learn it all yourself. You might as well use it. It's on a free resource.
Yeah. So. Hey, thanks for doing this, man.
Yeah, thanks for having me. This was actually really fun.
That was cool. So you guys share this on your page, because here's the thing that helps Scott. It helps me. It also,
veterans too. There's some great plans out there that are veteran specific.
Giri just can't get off that barn basketball.
I know. I grew up. We had this great barn that I lived at this wonderful place, and they had a basketball court in the barn, and it was the bee's knees. It still is. It's really cool. So
we may have to filter his questions from here on out. I think he knows too much about you.
Yeah, a little too much, Giri. Come on, man.
Okay, so go enjoy your evening with your family.
Thank you, Rick.
All right, we'll talk to you later. All right, you guys. So that is Scott Littlejohn, local insurance, but he's doing all this work to get folks ready for Medicaid and also Obamacare. plans. If you have a plan and you're not sure what you're doing, text him, call him, go in and talk to him, call him on the phone. He can tell you if you need to come in or what you need to do. But it's somebody to bounce that off of, because, there's not a lot of people who know that much about it. And please don't ask your friends what they did. that is, I mean, I'm sure you have very wonderful, smart friends, everybody, but they're not Scott. And I don't know how many people have got led the wrong way. Well, what I did was this. Well, you need to know what's working for you, because every single one of us is different. And Scott understands that. So he can work with you on a personal level. All right, you guys. So that is it for tonight. If you're going to go watch the debate, you got 15 minutes. Who knows? I don't, keep, I guess, a paper bag or something nearby, in case you get sick. I'm kidding. Don't get upset. Tomorrow at noon, we're going to be checking in with Any Lab Test Now. One of our clients, Stephanie and Adam, they do over 8,000 different lab tests, everything from diabetes, insulin levels. The big thing right now is vitamin D. And I know we have some sunshine, but it's not enough to get a lot of our levels up. My level of vitamin D is very low. That can lead to depression. It can also lead to other not sleeping. But one of the things they're finding in research that Stephanie's going to talk to us about tomorrow is some research that indicates that if your vitamin D levels are up, you're more resistant to COVID-19. And they give the shots out there, and you can get your shot, all that kind of stuff. And that's what I do. So it keeps me, just think what I'd be like without it. That's a scary world. Rick Dancer without vitamin D. Rick, you're awesome. Thanks for everything you do. Oh, Dakota, you're welcome, man. Yeah, you guys, but please share this on your page, because you don't know if somebody's going to come popping along and going, oh, wait, yeah, I'm supposed to be looking at my insurance thing. I don't know what to do. I'm going to call Scott up. So that helps him. And we want to help our clients, because we can bring this kind of information to you because of them. All right. Have a good night. I'm going to head home, and I probably am not going to watch the debates. I'll probably watch Netflix. Have a good night, you guys. See you later. That's not, if you want to watch them, I'm totally supportive of your ability to do so.